Rosacea is a chronic skin condition that predominantly affects the facial skin. It's not considered to be an autoimmune disease. It's considered more to be an inflammatory condition. Its exact reason is unknown, but we know that there's definitely a relationship between sun and sun exposure and rosacea, and genetics plays a part as well. It can affect anyone of any skin color, but it's more apparent in people with whiter skin tones because you can see redness of the skin, and sometimes the spots of rosacea can appear redder. There are different types of rosacea, and if you have one type of rosacea, you don't necessarily go on to get another type of rosacea, but you can definitely get an overlap where different types of rosacea cross over with each other. So the commonest types of rosacea we see, the first is erythematotelangiectatic. It's a bit of a mouthful, but what it describes is the appearance of vessels, blood vessels in the skin. This can also be associated with flushing of the skin. So the skin suddenly appearing very red, usually unpredictably, sometimes with a known trigger. And the telangiectatic part of the erythematotelangiectatic is seeing what appears to be broken vessels. So these are visible, persistent vessels around the this part of the face, so usually the cheeks, sometimes on the nose as well. Then you have papulopustular rosacea, and this likes the central part of the face, and it looks like little spots or pimples that are usually all the same size. There's no associated blackheads or whiteheads or comedones, so that makes it different from acne. And also these spots don't leave scars, although they can be persistent for several weeks. They're also not associated with oilier skin types, whereas acne is sometimes associated with having oilier skin. Then you can have ocular rosacea. So this is rosacea mainly around your eyelids, and it can give your eyes a very gritty sensation, and the eyelids can look quite red and irritated or inflamed. And then you can also have granulomatous rosacea. So people often think of a red nose, but it can also affect the forehead and the cheeks, and this is a thickening of the skin. So as earlier, I said that you don't have to get all types of rosacea, but some can definitely coexist. Most people with rosacea will also describe having very sensitive skin, regardless of the type of rosacea they have. And as with anything in medicine, it's usually a spectrum. So you can have a very mild form of papulopustular rosacea, which maybe doesn't really affect the quality of your life too much, or you can have a very severe form where you have a lot of spots, a lot of papules and pustules nearly all the time. That has a huge impact on your life. And that goes for the same with ocular rosacea or erythematotelangiectatic rosacea, and also granulomatous rosacea. So there is always a spectrum. So interestingly, nobody's 100% sure on what causes rosacea. There definitely are thoughts that it's something to do with how the sun interacts with blood vessels and vessels in our skin, making vessels a little bit leaky, and that leakage of the vessels can trigger a chronic inflammation in the skin, which will look like little the papules and pustules of rosacea, or around the eyelids, it can look like the ocular form of rosacea. And then eventually, if you keep getting lots of inflammation in the skin can thicken up, and that can give you the kind of this phymatous or granulomatous form of rosacea. There's also a thought that a particular mite that lives on our skin is also involved in rosacea. So that's why sometimes there are some treatments that can help reduce the mite that lives on all of us, but in people with rosacea, they're kind of susceptible to it. So certain treatments can act as an anti-mite and anti-inflammatory treatment, and that can help some types of rosacea. But the exact cause isn't known, but we know that sometimes it can run in families. And we know that for some people, their rosacea can start at a much earlier age than in other people. So the usual peak time for rosacea is somewhere between your 30s and 60s, although it can affect people who are much younger than that. Management of rosacea is very dependent on the type of rosacea you have and the symptoms you have with it. So depending on your type of rosacea, your dermatologist will tailor a treatment plan towards your type of rosacea and your lifestyle. If you have the kind of rosacea where you're affected a lot with flushing and what appears to be broken vessels on your skin, then we'll give advice on using skincare products that can mask a red face or reddening of the face. And we can also sometimes recommend types of laser therapy that can help reduce the appearance of blood vessels in the skin. If you have the rosacea where you get mainly a textural change, so the bumps on the skin or the papulopustular rosacea, then we often will recommend cream or topical treatments first. And if they don't help, then we might sometimes recommend an anti-inflammatory tablet known as doxycycline. It's an antibiotic, but in the levels that we use it for rosacea, it's used as an anti-inflammatory. And then if you have the rosacea that affects the eyes, we'll give advice on eye care and also sometimes introduce the anti-inflammatory tablet. If you have fibrous rosacea, so the rosacea that can affect the nose or the forehead or the cheeks, then sometimes the options are really surgical. We always recommend with rosacea sun care, really central to looking after the skin. So this is using high factor sunscreens, but also avoiding burning the skin and using physical sun protection like hats and long white sleeves and staying in the shade. We'll also give advice on using very gentle skincare products that don't irritate the skin, because a lot of people with rosacea will also have sensitive skin. So we'll give advice on using low irritation products that can soothe the skin and also help keep it well hydrated and avoid anything that can change the texture too much. Rosacea is a chronic condition. There isn't any treatment that we can give that makes it go away forever. So the aim of treatment is to manage it so that your rosacea is not having a negative impact on the quality of your life. So I have many patients with rosacea who have triggers, so things that they know make their rosacea worse. At the same time, I have lots of patients with rosacea who have no triggers that they can identify. So we usually will ask a patient if they know their triggers. Common triggers can be certain alcoholic drinks, although what is a trigger for one person may not be the same trigger for another person. Spicy food can sometimes be a trigger, but again, different people will have different experiences with the same spicy food. We always give advice on sun because we think that sun exposure has a relationship with the beginning of rosacea, so protecting yourself from excessive sun. And we always give advice on skincare, so making sure your moisturizers and your cleansers and any serums or active ingredients you're using are very gentle and soothing on the skin and don't potentially cause irritation, which can worsen a rosacea outbreak.